COVID-19 and influenza. What you need to know about getting vaccinated. During the fall season, we often see an increase of flu and other respiratory illnesses. This increase usually begins in October and tends to peak between December and February, although significant activity can be seen as late as May. Similarly, COVID-19 infection rates are also often high during fall and winter months, and some experts suggest that emerging COVID-19 variants and waning immunity could potentially push infection rates higher in the United States this winter. The impact of flu. Each year, on average, 5 to 20% of the United States population gets the flu. According to the Centers for Disease Control and Prevention, the flu resulted in approximately 9 to 41 million illnesses each year between 2010 and 2020. It is also estimated that the flu results in 31.4 million outpatient visits and more than 200,000 hospitalizations each year. The impact of COVID-19. As of November 1st, 2022, nearly 98 million cases of COVID-19 have been reported since January the 21st of 2020, and more than 1 million people have died from COVID-19 in the United States since that time, according to the Centers for Disease Control and Prevention. In Pennsylvania and West Virginia, more than 55,000 people have died from COVID-19 since January of 2020. The Centers for Disease Control and Prevention also reports that since August the 1st of 2020, nearly 5.5 million people in the United States have been hospitalized with COVID-19. Vaccines can help protect you from both the flu and COVID-19. For the 2022 season, Fluzone high-dose quadrivalent vaccine, Flublok quadrivalent recombinant flu vaccine, and the Fluad quadrivalent adjuvanted flu vaccine are available. These vaccines are approved for use in children as young as 6 months. For people 65 years and older, a higher dose or unadjuvanted flu vaccine is recommended. COVID-19 vaccines. COVID-19 vaccines have proven to be a safe and effective way of protecting against serious illness, hospitalization, and death. 4 COVID-19 vaccines are currently approved or authorized in the United States. They include Pfizer, Moderna, Novavax, and Johnson & Johnson's Janssen vaccine. Are you up to date with your COVID-19 vaccine? COVID-19 vaccine and booster recommendations are based on several factors. They include age, if you are immunocompromised, the type of vaccine given for your initial series, and the length of time since your last dose. In general, adults age 50 years or older who received an mRNA vaccine for their primary series, such as Pfizer or Moderna, should receive an updated bivalent booster if they have not had a booster in the past 2 months. Did you know that you can get your flu and COVID-19 vaccines at the same time? According to the Centers for Disease Control and Prevention, studies conducted throughout the COVID-19 pandemic indicate that it is safe to get both a flu vaccine and a COVID-19 vaccine at the same visit. Some people might prefer to get their vaccines at one time. This might be more convenient than having 2 separate visits. However, if you don't want to get your flu vaccine and COVID-19 vaccine or booster at the same time, there's no recommended waiting time between getting each vaccine. Common side effects. The most commonly reported side effects associated with vaccination are usually mild to moderate. They include fever, headache, fatigue or tiredness, and pain at the injection site. Serious side effects such as shortness of breath, chest pain, repeated vomiting, or severe allergic reaction are rare. However, if you experience any of these rare side effects, you should seek immediate medical attention. Now is the time to get your flu vaccine and COVID-19 bivalent booster. Check with your local pharmacy or primary care doctor to schedule yours today. For more information on flu and COVID-19 vaccines, or to locate a vaccination site near you, visit www.vaccines.gov.